everyone, I'm Stephanie Apt. I am your go-to source for Medicare education. And today I want to do a video about the changes happening to Medicare. I want to talk about some of the recent changes that are going to impact seniors over the next few years, as well as the proposed changes to Medicare and what that could mean for you. Now, I don't have a crystal ball and I can't predict the future, but based on what's happening in the Medicare landscape, I want to touch upon a few things that I think will continue to have a big impact over the next 5 years. So looking into 2030 as far as Medicare goes. Now, the first thing I want to talk of is the prescription drug cap at $2,000 per year for Medicare beneficiaries on Medicare Part D, which went into effect this year. So this cap is brand new as of 2025, and it's a really big deal for many seniors that are on expensive medications. The way it works is that if you're taking Part D covered medications, right, so that has to be covered by your Part D drug plan, then the maximum you're going to spend is $2,000 per year for your medications. Now, the catch is your medications have to be covered by the plan. And so some plans do have formulary restrictions where they're not covering certain medications. Additionally, some medications are going to be subject to what we call prior authorization or step therapy, meaning that it's going to take a little bit more for the insurance company to approve coverage for that drug. So what we've already seen this year is that certain drug plans are limiting their formularies, meaning limiting the number of medications that they're covering, or they are raising their premiums, right, their monthly premium costs of the drug plan in order to help balance out this new cap. So that's likely a trend that we will see continuing into the future years as long as this annual Part D drug cost cap remains in place. Another big change that we're already seeing, and I think we'll continue to see in the future years, are rising Medicare supplement plan premiums, especially certain plans. So I mentioned this in one of my last videos, but more and more states are now adding Medicare supplement birthday rules or anniversary rules, which is giving Medicare beneficiaries more opportunities to change their Medicare supplement plan every year without medical underwriting. Medical underwriting is something that is enforced by most Medicare supplement plans in most states. And what that means is that the insurance company can ask you a series of health questions on the application, or yes/no questions about your health. They ask you for a list of your medications, and then an underwriter looks at that and decides whether or not they'll approve you for coverage with that Medicare supplement insurance company. Now, typically, you only get one opportunity when you're brand new to Medicare to avoid that medical underwriting. It's called your Medigap open enrollment period. It's a 6-month window. Everyone gets one of them in which you can get any Medicare supplement plan without medical underwriting. And then after that window closes, if you want a Medicare supplement plan or you want to switch to a new plan or a new insurance company, typically you'll have to go through medical underwriting to qualify. And that medical underwriting, while can be a hassle for many people, it helps to keep the premiums lower, right, for your insurance plan, because the insurance company can kind of pick and choose which healthy people they are taking on to provide coverage to. Now, what we're seeing is more and more states are adopting these birthday rules where everyone will get a chance, if you have a Medicare supplement plan, to change to a different plan or a different insurance company once a year. Everyone gets that chance around their birthday. Now, not all states do this. There's still only a few states that do, but more and more states are adding this. And what we're seeing is when the states are adding these birthday rules, the premiums go up, right? Because there's less medical underwriting happening in the states that have these guaranteed issue birthday rule rights. Additionally, when we talk about Medicare supplement plans that are now closed blocks, we call them, so like Plan F, or Plan C. These are Medigap plans that used to be available, are now no longer available to newly eligible Medicare beneficiaries as of 2020. The pool of people that are on Plan F are now getting older, probably getting sicker, and there's no new young turning 65-year-olds coming on to that Plan F anymore. So it's likely that you'll see higher rate increases on a closed block plan like Plan F. Now, the good news is that you can shop your Medicare supplement plan to save money at any time during the year. Now, Keep in mind, usually medical underwriting will apply. So I recommend don't waste time. If you're in relatively good health now and you can qualify for a Medigap plan with a lower premium, now is really the time to take advantage of that. Another big Medicare trend, which will likely continue over the next few years, is going to be the growth of Medicare Advantage. So as you can see, Medicare Advantage plans have grown significantly over the past few years, and it's likely they will continue to grow in popularity. Right now, more than half of Medicare beneficiaries are on a Medicare Advantage plan, and that number is growing. So these plans do come with perks like $0 premiums or dental vision coverage included, but they can have their downsides, right? So most Medicare Advantage plans have pretty high co-pays or co-insurance for many services. Also, when we look at things like plans that require prior authorization and are more likely to deny claims, we see those numbers higher on Medicare Advantage compared to traditional Medicare. So if you're looking at a Medicare Advantage plan, you really want to make sure you're not just shopping the extras with your plan. You really want to look at the big picture when it comes to choosing the right Medicare Advantage plan. Most Medicare Advantage plans either fall under the umbrella of being an HMO or a PPO. Now, an HMO is a little bit more restrictive. You have to see certain doctors that take the plan. You typically need referrals if you want to see a specialist. And on a PPO plan, you have a lot more provider freedom. You can choose pretty much any doctor that will agree to bill the plan, although you pay extra if you're using an out-of-network provider, and you don't need referrals on a PPO. That being said, what we're seeing on the agent broker side is that more insurance companies are pushing the HMO model over the PPO model. They probably just make more money selling these HMO plans because they can be a little bit more restrictive. So we are seeing some Medicare Advantage insurance companies start to phase out some of their PPO plans and push more HMO plans. So it's really important to use a discerning eye when you're choosing your Medicare Advantage plan. You want to know the ins and outs so that you're choosing the right plan with the right coverage for your needs. Looking into the future of the next few years on Medicare, I think that supplemental plans will be more important than ever. Not Medigap Medicare supplement plans necessarily, but supplemental plans, things like hospital indemnity plans, cancer plans, dental vision plans, things that fill in the gaps in your Medicare coverage. For example, someone who's on a Medicare Advantage plan can often benefit greatly from something like a hospital indemnity plan or a cancer plan. These are plans that pay you directly if you get sick. So they can help to ease that financial burden on you if you have a plan that maybe has high co-pays or co-insurance for things like a hospital stay, or God forbid you get cancer, something like that. So these supplemental plans we're already seeing grow in popularity, especially as Medicare Advantage plans grow in popularity. Another good change that I'm seeing happening with Medicare, especially on the agent and broker side, is that CMS is starting to crack down on misleading Medicare marketing. That hopefully means that you will be seeing fewer confusing, misleading television commercials, and hopefully fewer telemarketers calling you all day long. But it also means that your agent, like me, we have to follow more strict rules and guidelines when we are reaching out to you to discuss your Medicare plan options. So what's important for you is to absolutely work with someone that you trust, that you feel comfortable with when you are making your Medicare choices. And they make Medicare confusing by design. So it's very important to have a trusted guide in your corner that can help you cut through the clutter and confusion and really keep you updated on all of the changes that are happening in the Medicare landscape. With the political climate today, there is so much uncertainty about what's going to happen with Medicare and Medicaid, and we get a lot of questions about that in my office. So we are absolutely here in your corner. We're going to keep you updated on any changes that happen to Medicare on the government level, and we don't use fear-mongering tactics, right? Like, I'm not trying to scare you about potential things that might happen. We want to give you factual information about what's happening today with Medicare. Thank you so much for watching. Please leave any questions, comments that you have for me in the comment section below. Like this video, subscribe to the channel if you haven't done so yet. We love having you here. Thanks for watching, and we'll see you soon.